Thanks again for being here. I think anybody who has followed me for any period of time knows that healthcare is absolutely my passion. As a 3-time breast cancer survivor who had every possible leg up in the world, from insurance to a good job, to a helpful family, all of it. I became very, very involved in health policy a long, long time ago because it was a great frustration for me that there were so many people that I heard from when I was anchoring the news who said, you know, we love you and we're praying for you and we want you to be okay, but you should know we're not all in the same position you're in. And that's why I started a charitable organization dealing with those issues. But that's what got me so focused on health policy and frankly so passionate about the fact that everyone should have access to good quality health care. So this is really personal for me. I am so excited about this effort, this Get Covered Jax effort, because the truth is education is an enormous part of this. And the great preponderance of people that go to our emergency rooms every time they get sick could have health care at very little, $10 a month, or no cost to them through the marketplace. And what we have to do is educate them. As I say so many times on issues that are complicated, a confused mind says no. And if you don't know how to access things, or it seems too difficult, or it seems too confusing, you're just not going to deal with it. And I can tell you, after 20 years of holding the hands of breast cancer patients through a process that is often extraordinarily confusing to them, that having navigators to help you through that process can be as valuable as any money in your pocket. Because a lot of times you can connect people to what they need simply with information. And information and education is not expensive. So that is something we are going to be spending an extraordinary amount of time with, whether it's this topic or others, making sure that our residents know what is available to them already. And this is why health was one of the pillars of my campaign. So no more is Jacksonville going to be a city that has the finest health care in the world, but some of the poorest primary health outcomes. I have been beating this drum, so hopefully you all know this, but we have some of the worst maternal and infant mortality numbers, not only in the state, but worse than some third world countries, especially in our African American community. And that is absolutely unacceptable. Our measures of primary health are in the lower third. So those are things that are fixable and things that we need to focus on. And so we will with this campaign. Our mission is to increase access and improve equity in healthcare, so that we can start to improve those numbers. And we're already developing unique and game-changing ways to do that in Jacksonville. All this work comes from my belief that a healthy Jacksonville is absolutely foundational to the health of our city, both physically and financially. So solving problems and finding solutions are a path forward to keep doing better for our residents. One of the best ways to lead them toward healthier lives is ensuring, as I said, that they have health insurance. It's with that goal in mind that we are launching Get Covered Jax. So from November 1st to January 15th, eligible individuals can enroll in a private healthcare plan through the Florida health insurance market. This new initiative is designed to remind our citizens that there are affordable and even no-cost plans available, no matter what your financial situation is. We want enrollment to be as smooth and as simple as possible. So I'm so excited to bring this public education campaign to fruition. I'm grateful to Dr. Joshi, to Lynn Sherman, and the creativity of our entire team creating this effort in such a short amount of time and without any extra taxpayer dollars behind it. In a few minutes, you'll hear more from them and get the details on Get Covered Jax. But first, I would like to thank Councilman Boylan for being here with us today. He has really been at the forefront of health policy at City Hall. As chair of the Committee on Critical Quality of Life Issues and chair of the Neighborhoods, Community Services, Public Health, and Safety Committee. He's going to tell us more about how Get Covered Jax aligns with the priorities of the City Council. Councilman Boylan.
Good morning. And thank you again, Mayor Deegan. I would be remiss if I didn't first recognize the personal battle you faced and the leadership you exhibited prior to taking office and now as our mayor. As I shared with your staff, the health and well-being of every one of our citizens is, as it should be, utmost priority of your administration and my colleagues on City Council. It was personally important to me that we include access to health care as one of the three cornerstones of the Critical Quality of Life Issues Committee, which I had the honor of leading. According to most recent estimates, roughly 12% of the population of Duval County has no form of medical coverage. That's roughly 120,000 citizens. We hope, who hope and pray that they stay healthy or find themselves ultimately using the emergency departments of our area hospitals to provide urgent medical services. Doing so is at a tremendous cost to the respective hospitals, or as importantly, to the tax-paying citizens of Jacksonville. I am so very pleased the administration has fully embraced the very first recommendation of the CQLI work regarding access to health care, and I quote, to develop a marketing campaign that encourages Jacksonville residents to find a medical home. Today's announcement is an excellent example of our two bodies working together to address such a critical quality of life issue. That said, I also want to commend my colleagues in their collective support of the $1.5 million to Jax Care Connect program administered by We Care, and the 7 free and charitable clinics who strive to assist our citizens in not only providing primary care services, but to lend a hand in assisting our most vulnerable in securing health care insurance. To that end, I would respectfully ask that Jax Care Connect be added to the additional resource for citizens to turn to for assistance. I laud the work of the administration in this regard and am proud to be part of today's announcement. Thank you, Mayor Deegan.
Thank you so much, Councilman, and absolutely. These are the efforts that we have undertaken here in City Hall since our administration came here is really to build upon what we're doing at Jax Care Connect. We want all of this. We have so many powerful and amazing nonprofits in our community. And as I've said often, our nonprofit community is so precious, and we must have public-private partnerships because they are the most innovative, they're the most nimble. They have to work harder, they have to work smarter because nonprofits are the first things to go when people's budgets get tight. So it's incredibly important to work with the folks who are doing all that wonderful work, and we absolutely will continue to partner there and build on the good work that they're doing. I was so grateful when Dr. Sunil Joshi agreed to come on as our chief health officer. What a passion for Jacksonville he has. And I'm so grateful to him for leading our entire effort on this front, but for really focusing in on the importance of this piece. Because if we can simply get people covered, that's a big, big step toward creating a healthier Jacksonville. So with that, I'll turn it over to Dr. Joshi.
Thank you, Mayor Deegan, for your passion for health in Jacksonville. There's no question that better days are ahead for our community. So as most of you know, Duval County ranks 46th out of 67 Florida counties in health outcomes. Our primary goal here is to improve the health of every corner of Jacksonville, Florida. There are many factors that affect health in a community, and believe it or not, that care that we provide as physicians and healthcare providers in the room with the patient only makes up about 20% of the health outcomes. The other 80% are due to social and economic factors, health behaviors, and physical environments. So places you live, housing, your job, your income all play a role. This is how the disparities in a community can lead to inequities in healthcare. And we see that here in Jacksonville. So an important area we need to be more equitable with, of course, is health insurance. And through the years, and in particular in the last 4 months since we've started here at City Hall, we have learned that there are 4 things people want with health insurance: freedom, trust, personalized care, and ease of access. So by freedom, I mean they want their health insurance to provide them with the freedom of not having to worry about being sick, not have to worry about having to go to the hospital and pay for that high cost of care. By trust, they want to trust that that health insurance and affordable health care will not just be there for them today, but tomorrow, the weeks, the months, the years to come, going forward to have that affordable health care. Personalized care, people want health care. They want what they need, when they need it, where they want to have it, and how they want to have it as well. And then an easy system to navigate, a very navigable, easy to understand way to sign up for health insurance. And that's what brings us to Get Covered Jax, which is designed to make health insurance coverage and care open and transparent, and to take the fear of keeping you and your family safe out of the equation. We might even help you save some money along the way. It is that time of the year now for marketplace enrollment in the Affordable Care Act. Since this program was put in place in 2010 and implemented in 2014, millions of Americans have benefited from health insurance. In Duval County, as Councilman Boylan just mentioned, about 10 to 13% of our population is uninsured. That's 120,000 adults under the age of 65. So why should we care? Why does this matter to the rest of us? Why does it matter to the people who don't have health insurance? Because health insurance does make a difference. According to the Healthy People 2030 data, lack of health insurance coverage negatively impacts health. Uninsured adults are less likely to receive preventative services for chronic conditions such as diabetes, cancer, heart disease, and stroke prevention. Similarly, children without health insurance are less likely to receive appropriate treatment for asthma and critical preventative services such as dental care, immunizations, and well-child visits, which of course are important for tracking milestones in development. In contrast, studies show that having health insurance is associated with improved access to health services and better health monitoring. A study recently suggested that folks who previously did not have health insurance but now signed up for a marketplace plan were more likely to be screened for, treated for, and managed for diabetes. And this led to less complications from the disease as well. So that's just one of the chronic disease processes that have been impacted. Is health insurance expensive? Yes, it can be very costly. But through marketplace plans, people with income at the federal poverty level all the way up to 400% of that, which takes you from about $13,000 a year of annual income to about $54,000 a year, could qualify for subsidies to reduce the cost of their monthly premiums. According to the subsidy calculator at healthinsurance.org, and I know this because I have a patient who went through this with us just very recently. A 34-year-old single mother of two children, making about $33,000 per year, living in the zip code 32209, would qualify for a $419 per month subsidy. So if the health insurance plan that she likes is going to cost $800 a month, and this is what's going to cover her family and cover her cost of prescription drugs, it would now only be $381 a month. That's a 52% reduction in the cost of her premiums, $5,000 a year in savings. So that is a way to reduce the healthcare cost for this individual. But also there's services, if you get health insurance through the marketplace, primary preventative services are covered at no cost to the insured individual. That includes yearly health exams, screening blood work, screening colonoscopies, mammograms, pap smears, immunizations such as the flu shot and shingles vaccines are at no cost to the patient. Other services that are covered with cost sharings will include maternity and newborn care, mental health and substance use disorders, prescription drugs, emergency room visits, hospitalizations, laboratory services, and pediatric services outside of wheelchair care visits, including dental care and vision care. A lot of things people don't understand. The biggest issue that I hear from folks is pre-existing conditions. I have diabetes, heart disease, and had a stroke. There's no way they're going to cover me. Well, that is not true. All marketplace plans must cover treatment for pre-existing medical conditions. No insurance plan can reject you, charge you more, or refuse to pay for essential healthcare benefits for any condition that you had before coverage started. So we hope that you will now see that there are many, many benefits to having health insurance, and we encourage you to get Covered Jax. I will turn it over to our amazing Executive Director of Health Programming for the City of Jacksonville, Ms. Lynn Sherman, who will share with you how we're going to get the word out, how we're going to promote this campaign, and how we move forward. Thank you.
Good morning, everyone. I want to thank you for joining us today to discuss this important initiative that the City of Jacksonville is undertaking to promote and encourage community members to enroll in a private health care plan through the Florida Insurance Marketplace during this open enrollment period. Our commitment to the well-being of our residents knows no bounds, and ensuring access to affordable health care is at the core of our mission. In an effort to achieve this mission, we are implementing a multifaceted approach designed to resonate with the unique needs and preferences of our diverse population. First and foremost, we have created a landing page on our city's website that serves as a central hub for the marketplace insurance information. It provides easy access to enrollment, resource guides, frequently asked questions, and assistance, ensuring that anyone who visits our website can connect to the information they need to make informed decisions about their healthcare coverage. Recognizing the power of social media, we're launching a series of posts that resonate with our wonderful, diverse population. Our goal is to ensure that the message reaches everyone, regardless of their background, their language, their culture. By crafting posts that reflect the rich quilt of Jacksonville, we aim to connect with each of you. We also understand the importance of collaboration, and we're working closely with our local media partners to amplify our message. You will see informative segments, interviews, and articles in local news outlets spreading the word about the benefits of getting covered with health insurance and how it can positively impact you. We're also working closely with our local faith community to provide information sessions in person as well as virtually in our effort to meet people where they are. These sessions, along with flyers, will help us to reach those who might not have access to the internet or social media, ensuring that nobody is left behind. Because when it comes to securing affordable health care coverage, it is important that we're able to meet people where they are. So I recall my friend Lisa, a few years ago, single mother who struggled to make ends meet while facing the burden of mounting medical bills because she, like many others that many of us know, often used the emergency room to receive primary care. She was hesitant to enroll, thinking it might be too complicated or too expensive. However, with the patience of an insurance broker, a very kind insurance broker, Lisa discovered that she was eligible for an insurance plan from the insurance marketplace that was affordable for her, which really ended up relieving her of a huge burden in her life. With her new insurance, Lisa was able to access regular checkups, preventive care, and even much needed treatments that she'd been putting off for years. Her story is a testament to the transformational power of affordable health care, and it serves as a reminder of the positive impact we have on the lives of our fellow Jacksonville residents. Our commitment to promoting the health insurance marketplace enrollment is unwavering. We invite all uninsured residents to to explore their options, to take advantage of the resources available, and enroll in the insurance plan that suits their needs. Together, we can ensure a healthier and more prosperous future for our city. Thank you.
Thank you, Sunil. Thank you, Len. And with that, any questions on healthcare, we're happy to answer. Any of us, if you have questions, fire away. Yes.
I'll ask, it's one thing to have access to insurance, it's another to understand how to navigate the system beyond that.
Mhm.
So is there a plan to engage the community to connect them to doctors, make sure they're following up, and how are they gonna really get the benefit of this insurance that they're now?
Sunil?
Yes. That's a good question. And so part of this is on our website, we have links to navigators as well as licensed insurance brokers and federally trained assisters to help people get through and navigate through the health insurance plans. Most of these navigators and insurance brokers will also make sure that not only once they help you sign up, that they also encourage you to get that first appointment with a primary care doctor, and will follow through. Some of them will follow through at 6 months, 9 months, and 12 months to make sure that you have seen your doctor and have gone through the preventative services. So part of that is to also then make sure next year they sign up again for the healthcare insurance, but also to make sure they're doing what they need to do as they go through the year.
Anyone else? Okay.
I think you're going to find that there are a lot of people out there, particularly the homeless population, and that we see that growing here in Jacksonville, that go to the emergency room that you're talking about. How do you reach them? And they don't have any money, even, you know, it may not be affordable for them. You know, is there a way to deal with that?
Well, look, Jim, and I'll let Sunil come up again, in a second and talk about that. But I think that what you see is a lot of folks that are not part of that population accessing the emergency room. That's where the big problems come in, where you have the thousands of people who really would have a very easy time signing up for this process. Truly indigent people don't really have an issue so much. It is folks who are not on that level, but we absolutely need efforts to reach them. But my point is, we have a whole population of people who are using the emergency room as their primary care. That's the big issue, that in terms of cost and in terms of what we can do to really move that dial. Our homeless population certainly is one that we're very concerned about. When you look at them compared to the greater community, they're a very small part of that population. But I'll let Sunil add anything else he wants to add there.
Yeah, I think an important part of that is we do have access points for care for our homeless population. Our Duval Safety Net clinics, which some of them are here. UF Health has safety net clinics as well. So those folks do have access to primary care. We just need to get that word out to them. And we certainly will work with our Changing Homelessness not-for-profits out there to get that word on the street as well. But a lot of those folks actually do have access to primary care. They just may not know it, and we need to get that information out there. It is, as the mayor said, the folks who are the working poor, so to speak, who do not have health insurance, may have housing, may have a job, but they just don't qualify for health insurance unless they go through the marketplace. Those are the ones that we're really targeting for this.
And I would also remind us too that, we as a city invested in administration and the council $40 million to support indigent care with UF Health. So we do understand and appreciate the importance of making certain we provide them the kind of care that they need in that process. But I concur completely. It's a study we learned last year. It really is accessed by those people who have the wherewithal to support themselves through this process if they know how to do it. And to the earlier question, I might suggest too, have them talk to Jax Care Connect. They have care patient advocates who do the very work that help people navigate that difficult path. Thank you.
Any other questions? Okay. Thank you, everybody. Appreciate you very much.